Hi guys, my name is Thao and I am one of the 3 registered dietitian here at OakBend Medical Center. And today I'd like to go over a few changes in our nutrition label that the FDA recently made. Now to the left, this is what your old nutrition facts would look like, and this is the new version. And as you can see, the first thing that will jump out at you is your calories because it's going to be bolded and in a much larger font. This makes it easier for the consumer to navigate the nutrition facts label. The serving size is also going to be bolded, and just so that we're clear, serving sizes are often calculated as what is commonly eaten in one serving. It is actually not a recommended amount to be eaten in one sitting. And then as we go down the list, you can see that not much has changed for the first couple of micronutrients. Total fats, unsaturated fat, trans fat will stay the same. Cholesterol level will also be listed. Your sodium level is one to be looked out for. The American Heart Association recommended an intake of less than 2,300 milligrams per day, and those with conditions like congestive heart failure or kidney disease, you might even want to go as low as 1,500 milligrams. So you definitely want to consult your doctor and your dietitian for that amount. Under total carbohydrate, and this is where I like to educate my diabetes patients, this is the number that you want to pay attention to when you're counting your carbohydrate to match your insulin level. Now in this specific packaging, it's going to have 37 grams of carbohydrate per serving. So that means that you're getting in more than 2 servings of your carbohydrates, so that makes it easier for you to calculate out how much insulin you need for that meal. Under total carbohydrate, the one important thing that is being added to the new nutrition label is the amount of added sugar. Now, added sugar had been associated with obesity and other chronic disease, and so trying to have a diet that is low in added sugar, actually it's been recommended to eat a diet that is less than 10% of added sugar is very beneficial to your health. And then your protein amount will stay around the same font and sizes. And as we look through the percentage of daily value, this number would represent the amount of each nutrient that is in each servings, and this is the percentage that it correlates to your total daily intake. As a good guide of reference, anything that is 5% or less means that it's going to be lower in that nutrient. And then 20% or more is going to be high in that nutrient. So in this specific label, you're looking at an item that could potentially be labeled as low fat because it only has 5% of daily value of saturated fat. And then this is also going to be very high in added sugar because it's about 20% of your daily value of added sugar. Now, as we look through the micronutrient panel, 2 micronutrients that are being listed is vitamin D and potassium, and this is due to the high amount of deficiency that is being shown recently. Vitamin D is very high in all of your dairy products. It's also going to be very high in all of your organ meats, so if you are into eating livers or kidneys or things like that, that's a wonderful source of vitamin D. Your potassium is going to be very high in all fruits and vegetables, but again, if you are somebody with a condition like kidney disease, then you might want to pay attention to the number of or the amount of potassium in your food as well. And then, besides just looking at the nutrition facts, another thing that we want to pay attention to when we buy food at the grocery store is going to be your ingredient list. When you read your ingredient list, please note that the amount of the ingredient that is listed first will have the highest concentration in the whole package, and it's going to be in a descending order from there. I also have this little sheet here that has all the names of added sugar that might be undercover in the nutrition label. High fructose corn syrup is also a type of sugar, and it is actually the #1 drive for non-alcoholic fatty liver disease. So all of these names can be hidden in your food product as an added sugar. And there you go. That's all I have for you today for the new nutrition fact label. If you have any questions, please don't hesitate to reach out to us and give us a call. Make an appointment with one of our outpatient dietitians so we can sit down and have a whole hour with you. Have a good day.